Now to a fascinating story about a remarkable young man, James Mooney, who is already taking a leadership role in helping some of the world's most vulnerable people, young children diagnosed with cancer. Two hospitals are partnering together to address pediatric cancer in Mbarara, Western Uganda. VOA's Paul Ndiho, along with Godfrey Badebye from our partner station NBS-TV in Uganda, filed this report from Boston, Massachusetts.
The World Health Organization reports over 200,000 children worldwide receive a cancer diagnosis each year. 90% of the deaths in children with cancer are in low-income countries where medical care is not available or inadequate to treat their cancers. Well, I've come here in Boston, Massachusetts, to find out more about pediatric cancer and what this partnership between Massachusetts General Hospital and Mbarara Regional Referral Hospital in southwestern Uganda is all about. It all started nearly 3 years ago when a young James Mooney was on a summer vacation with his parents visiting Mbarara Hospital and a village home of a sick child. This eye-opening journey inspired James Mooney to return with a plan to raise awareness for children with cancer by recruiting students to run in a race, Uganda's Color Run for Pediatric Cancer.
One of the things we did first was the malnutrition ward, and that was kind of what struck me because it was a bunch of kids, obviously like a lot younger than me, but they were really struggling, and it was all just because, you know, they had a lack of nutrition, a lack of food.
James Mooney comes from a generous family. Their Mooney Reed Charitable Foundation has given away more than 13 million in charitable contributions in recent years. The Mooney family is based in Boston, Massachusetts. James is developing his own interest in Uganda.
The first day I arrived in Uganda was a bit of a culture shock because I got off the plane at like, I think 11:30 at night Uganda time, and the thing is we flew into Entebbe, and Entebbe, at least compared to Boston, there's no lights or anything. So
James Mooney and his family, in collaboration with Massachusetts General Hospital, have since built strong ties with Mbarara University and Mbarara Hospital, and promise to be a lifeline for those children diagnosed with cancer. Dr. Howard Weinstein, Chief of Pediatric Hematology and Oncology at Mass General Hospital for Children, has made several trips to Uganda.
Develop a childhood cancer program that involves training doctors, nurses, pharmacists, and pathologists how to diagnose and treat children with cancer.
Cancer in children differs considerably from cancer in people of all other ages.
We don't know what causes childhood cancer, but despite that, we can successfully treat many, many children.
The collaboration between Mbarara University Hospital and Mass General physicians and scientists began over a decade ago. Carla Olivier is a nurse practitioner at the Cancer Center with its Global Health Program.
They know exactly what to do to help the patient get through this diagnosis. And I think about the patients that we meet here or that we meet in Mbarara. The desire to be well and to be healthy is universal.
Dr. Christine Barige, director of the Mbarara Regional Referral Hospital, said with the help of Mass General Hospital, they have built a new ward for pediatric cancer, and cancer patients, especially children, have been moved away from those with general illnesses.
I appreciate Massachusetts General Hospital from the United States, who have given us the money which came from the other run that we held at the other playground of the university, that we were able to construct and initiate this.
Meanwhile, last year, Uganda's only radiotherapy machine used for treating cancer broke down beyond repair, and that left thousands unable to get a potentially life-saving treatment. Paul Ndiho, VOA News, Washington.